Welcome, everyone. Thank you for joining us. I'm Kathleen Elmore, Managing Director of Engagys. We are delighted to have more than 100 of you with us today for a timely discussion on 2020 trends in consumer health engagement. I'm super excited to spend the next hour with our guest star and healthcare leader joining us today. But before I introduce our esteemed speaker, I'd like to review a few logistics. Our webinar will be about 40 to 45 minutes of formal presentation, followed by 15 minutes of Q&A. Feel free to ask your questions during the webinar. You'll see on your GoToMeeting taskbar a place to enter those questions, and you can do that at any time as we're speaking. And with that, I'd like to introduce today's speaker. So I'm especially delighted to welcome our guest star, Teresa Johnson, who is Senior Vice President of Consumer Experience Solutions for Capital District Physicians Health Plan. Teresa, tell us a little bit about your background and how you came to have a very consumer-focused title.
Sure. Hi, everyone. So I've been at CDPHP for a good many years in a variety of different roles, but really always focused on engaging employers and consumers by creating innovative products and services to make them want to live their healthiest life, remove friction from the process, and really have it be affordable for them. So while I've had a lot of different positions, always been kind of laser focused on the consumer. So here we call them members or future members. That's really been my area of focus. And from a title standpoint, I'm sure that we stole that from somebody else's title in a different industry.
That's fantastic. Well, welcome, Teresa. We're thrilled to have you on here. Today's session is going to be comprised of three sections. One is I'll spend a couple of minutes talking about the current landscape and the market reaction to that. And then Teresa and I will dive into the trends, just looking through the lens of consumer engagement of what's hot and coming up for 2020. And then finally, we'll open it up to Q&A. And so we'd love to hear from you all that are listening in today on kind of what's on your mind around the focus for 2020. So current landscape, really what's happening now is the time to self-disrupt is here. We have four forces that are really accelerating the momentum towards a complete transformation to really what we call consumer centricity, and that is designing the healthcare experience around the individual consumer. Four forces include, first, the consumers have changed. We've seen studies in the last couple of years that show that consumers no longer compare their healthcare experiences to experiences within healthcare. They're comparing them to their favorite brands, and so the bar is high. At the same time, investment in digital health continues to grow. At last count, there's $8 billion focused on companies that are trying to disrupt the current ecosystem. Then we have this next generation of payers that really aren't burdened by the legacy infrastructure that the current stakeholders are. Instead, they can design from the ground up for this B2C experience. And then finally, the giants at the gate. We all know that there's giant entrants coming into the healthcare world, companies that have, made their fortunes in driving individual behaviors, but at scale, are now coming to healthcare to do the same. So lots of opportunity, for disruption. But at the same time, the good news is we're seeing a reaction from the current industry stakeholders who are really taking cues from these leading companies. We're seeing work done on brand, and brand for a long time was kind of something that really happened in the ivory tower. Now what companies are realizing is that day-to-day interaction with consumers can be made so much better when you've built a trusted brand. We've seen things like, 5 to 10 percentage points of lift when we use the right brand as the sender or in the caller ID for a communication. And so really thinking about your brand, especially as we ask consumers to make these tough decisions, is key. Consumer profiles, that's a big area that's being developed on that we're going to talk a lot about. An example that I love to use from outside of healthcare is Netflix. How great is it that when you go back to Netflix, everything is queued up right where you left it? Imagine working across your ecosystem of specialists and providers in your health plan, and you never had to kind of retell your story, that everybody was kind of up to date with where you are, right? What a different world that would be. Satisfaction, we're going to talk a lot about NPS, but really it's getting so much more sophisticated in healthcare. It's not just kind of yearly surveys. It's really understanding context and driving value and how to measure satisfaction in a way that's actionable. I put American Express on here. I love that they really understand that end-to-end experience of consumers and how that sum of interactions kind of creates that whole really mindset of how consumers feel about their health and healthcare. And then finally, personalization. I think personalization is going to become a big buzzword for this year. And personalization is no longer about really, what the name on the letter or the name in the email. It's really about directing the actions to that specific consumer. We've seen great results that even reminding this consumer to get their gaps in cares closed, that when we actually call out the individual gaps that specific person needs, they're 3 times more likely to actually close at least one of those gaps. So a deep, deep level of personalization works. Just for fun, Teresa, how many ways do you think that Starbucks claims to be able to personalize your beverage?
Geez, I really don't have any idea. I would say hundreds.
Good guess. According to Forbes and HuffPost, they actually claim to be able to personalize 18,000 variations of their beverages. So when it comes to Starbucks, the bar is super high for personalization. The last couple of slides before I open it up to Teresa and I is really around, we do a state of engagement survey across the top 150 health plans, provider systems, and PBMs each year. We do it in partnership with RISE, really looking at the state of engagement in the U.S. today. And so this slide shows the good news is the executive attention and the budgets towards consumer engagement continues to grow. And we've seen that, increase year after year. Next up is we asked folks what really was on their docket for prioritizing investment around consumer engagement. And we heard loud and clear things like the member portal, multi-channel capabilities, getting rid of paper as much as possible, as well as kind of that 360 view, and also working on social determinants were really kind of their top focus, their top areas of focus for 2020. Teresa, does this resonate with you? Does it line up with your priorities?
It certainly does. This past year in the summer, we launched a new member portal that we spent about 10 months developing and doing customer focus groups really to be more self-service capabilities and meet the member where they wanted to be. So we did a huge investment in that and rolled that in the summer, and it's been really successful. We've certainly increased the number of folks who have registered for our portal and are actively using it. And with those enhancements, we've been able to gain a ton of insight that we weren't able to glean from our old portal. So down to the level of click where people are going and what they're interested in. So we review those weekly and certainly every month to identify trends and figure out how we can improve, make incremental improvements. The next one down the chain, the multi-channel marketing. Last fall or a year ago, in fall in 2018, we launched Marketing Cloud. So we're able to send out more personalized communications and do multi-channel there as well. And then lastly, reducing paper communication. So 2020, one of our goals is to transition more to digital, and we can talk about that a little bit later in the presentation.
Sounds great. And it's wonderful to hear just how successfully your portal, is working for you, both in terms of the consumer engagement, but also the insights you can use to drive better experience. That's awesome. It's a double win.
Yeah, it's been great.
That's great. So trends-wise, the first trend we'll start off with is really consumer engagement infrastructure. If I were to say, as I look across all the different plans we work with, if I were to coin 2020 as the year of something, I would call it the year of consumer engagement enabling infrastructure. So no longer are people just worried about kind of those frontline interactions. They're really blowing up the current ecosystem and starting from scratch to really tie the legacy systems together to figure out how to become more nimble when it comes to things like composition tools, capturing preferences, really building that people, process, technology infrastructure necessary to create that personalized experience. So that's fantastic. And then what we're seeing, which is really interesting, is the way to justify and to get funding for that is really through just what you talked about, getting rid of papers, through the administrative savings of less paper, saving on driving self-serve, things like that, as well as the medical outcomes. And so it's really using that funding to build those member experience enhancements, which is exciting to see. And then lastly, these efforts, you can look at them in so many different chunks, right? As we talked about governance, we've helped folks stand up centers of excellence around SMS and email, driving better analytics and really driving data consolidation. Teresa, you're working across a variety of these initiatives. Tell us about a couple that you're into and what that's done for you. Teresa, you might be on mute.
Oh, sorry. We started about 18 months ago a committee to really assess all of the member communications going out of our organization. So it's a cross-functional team. It's fairly small, but if someone wants to do a consumer-facing kind of mailing or initiative, it comes through that committee. Not really for a go, no-go decision or to say, yeah, it's a good idea or it's a bad idea, but really more to organize and make sure that we're staying focused on the consumer. So a great example would be gaps in care. So we've got a bunch of different teams trying to close gaps in care, and it wasn't focused from a consumer perspective. So we could be hitting them with multiple mailings or multiple communications to encourage them to fill their gap in care, but no one was looking at that from a centralized standpoint to say, we should consolidate some of these things and make sure that we're putting the consumer in the middle and focusing on the gap that we think is most important for them rather than just sending them a bunch of different communications. So all communications from wanting to update our website, any customer-facing initiative goes through that team. We have a tracker that we keep track of all of them and make sure that we're managing them appropriately. Again, always keeping the consumer in the middle. So that's been successful. We've had about 70 multi-channel marketing projects go through there over the last 18 months, and we are measuring an uptick in engagement and closing those gaps in care. So that's been great. And one point I wanted to go back to you made on the previous slide, Kathleen, was, how do you fund these kind of activities? And really, for us, we looked at all the different member communications that were going out and looked for some low-hanging fruit. An example of that is our flu shot. So we used to send out a letter, the same letter to 100,000 people. It cost us a bunch of money. And 2 years ago, we looked at that and said, how can we be more strategic in that communication? So we went digital, and we segmented and made emails more personal topics based on if you were a student, if you were a parent versus a caregiver, to really try to be focused and create a reason for someone to get their flu shot. And we didn't focus on the ones that got them every year, right? They're going to get them. So we've been able to increase by 35% an uptick in flu shots by doing just that, and saved between $70,000 and $80,000, which allowed us to then reinvest that money into looking at other solutions and other possibilities, and one of which we worked with Engagys on creating an inventory of all of our member communications. So you can fund that kind of activity by being smart about it.
That is amazing, Teresa. So not only funding it, and saving $80K, but then you got a 35% uptick. That's again, huge success. Congratulations. So next up is technology innovation. A lot of themes to talk about here. Obviously, we're going to focus on the ones that have to do with consumer engagement. I'll mention a couple here, and then we'll deep dive into some of the work that Teresa's doing. One we're seeing is artificial intelligence, things like using Einstein, which is part of Marketing Cloud, to predict the best time a certain consumer, an individual consumer, might be most receptive to an email, right? Again, all of these little things leading to better engagement. Artificial intelligence is also doing some cool work in developing wingmen for people with disabilities and those with dementia, helping them, accomplish their activities of daily living. And then finally, a couple that I've seen out there are some cool robots helping folks with med adherence and reminding them to take their meds. So much on that front, probably too much to talk about. And the next area of technology innovation is really this digital transformation, which we're kind of touching on in all of the topics that we're talking about today, because there's so much to it, right? It's everything from building the governance to capturing the preferences to figuring out that logical architecture in order to really drive consumer centricity. So a ton of work's being done on that, and I think we're going to see some big transformation this year of putting digital first and seeing consumers really start to have that two-way interaction with their healthcare organizations. The last area is this 360 view of consumer. This is really table stakes in big consumer organizations, and I love the promise it holds for the healthcare world. One of the things I always talk about is, we've got this great repository of claims of what consumers did, but now when we can finally add all of the touches that we have with consumers, outbound communications, inbound calls, things like that, we can really overlay what consumers did with how we got them to do it and start to get better and better at engaging with consumers. When I think about the technology vendors that are out there, we've touched or worked with so many cool, innovative companies. Teresa, I know some of these are companies you've also interacted with. Do you want to pick a few out and talk about what you're working on with them?
Sure. We have met and have long-standing relationships with a few of these vendors, and I'll just call a couple of them out. So first, WellTalk. We've been a strategic partner of WellTalk for years now. They have a health and wellness engagement platform called Cafe Well that we use kind of as our hub for health and wellness, and that's been very successful. They have an ecosystem that allows us to plug and play other types of partner solutions, whether it be focused on a chronic condition or gym memberships or what have you. So that's worked out well for us, really to make a one-stop shop for our consumers, and we don't kill them right with app fatigue. The other, where we're investing an enormous amount of time and resource, is with Salesforce. So we have begun the journey about 2 years ago to get the 360 view of the consumer, really targeting different initiatives within the organization, and we've been chipping away at that for a while now. So just some examples of things that we've rolled out there. We're using Salesforce for our Medicare sales area, so understanding and promoting from a lead gen, prospects, and then through the enrollment process. We've rolled it out to our pharmacy care team, as well as our member services. So we have now connected those two pieces to get a broader view of the consumer, and again, trying to keep them in the middle. We rolled out Marketing Cloud, as I said, about 18 months ago now, and are in the process of integrating that with Health Cloud. So all of our marketing campaigns that are going out to members based on different cohorts, et cetera, now that visibility is in the customer service team. So when they're speaking to a member on the telephone, they can promote something that we're trying to promote digitally. So that's been great. And then lastly, we are using Salesforce to be the center of our hospital experience program. So we actually have folks in the hospital. We have some of our medical directors that do rounds in the hospital. We have nurses in the hospitals, and we also have a customer service advocates in the hospital. So making sure that if someone is inpatient, that we are taking good care of them, and we're using Salesforce as the hub to communicate between all of those folks. And that's been amazing, really. So just some examples of how we're using Salesforce and really continuing to build on that total 360 view of the consumer.
That is amazing. She said really tying that ecosystem together for the consumer, which is going to go such a long way in both, helping them promote their health, but also helping them manage and navigate their health care. So that's fantastic. It's really cool too, when you think about just, only a few years ago, if someone called in asking about a communication, the call center rep would have to say, oh, well, why don't you fax that to us and we can see what you're talking about. But now with the way, you're doing things, it takes all of that, out of the equation. And now it's at their fingertips of what that consumer received, and they can really have just a much more productive interaction. Next up is engagement and experience. Really, the big theme here is engagement, but so much of it is really about the total experience. We're going to talk about some key themes, and Teresa's going to have a lot to say. Net Promoter Score, communications optimization, and of course, social determinants of health. For those folks out there listening, I'm doing a live focus group in March at a social determinants health conference put on by RISE in Nashville. And so if any of you here listening have burning questions that you'd like to ask a group of folks that are challenged with social determinants of health, I would love to be able to take your questions and report back to you. Because I think, as a group, I think we all have things we're working on. So that'd be something that would be really exciting to have real world questions. So please send them over. Going back to the study that we do each year, we ask folks, what really is kind of in your way, do you think, to better engagement? And so we hear this kind of theme of consumer collisions or communications collisions, or consumers receiving just too much. And that's a real issue. We're finding even across industries, consumers are living in a tsunami of information overload between social media, traditional media, and you're getting marketed to at the gas pump. And so you add messages that really, aren't the brand new shiny sneakers. These are things that maybe consumers aren't that excited to hear. It's really critical to break through that noise, both with relevance and also really paring down and optimizing that stream. Teresa, looking at this list, what resonates with you?
Well, certainly consumers receiving too many touches. I think that's true. But I also, what we've found anyway at CDPHP is that there are some consumers that need us to be reaching out to them, and we don't. So I think there are a bunch of cases where we don't have nearly as many touches as we should. And so again, it goes back to being relevant and being meaningful. We did a huge push on getting our arms around, if you will, to help support our people with diabetes in the plan. And we started out with doing a journey mapping session and created a few different personas and went through the journey of somebody getting diagnosed and becoming aware that they have diabetes and walking through all of their care. And what we found is a couple of the personas, we may send them a letter if we get something that says, oops, this person has been diagnosed with diabetes, but nothing else. They never hear back from us. And so some of them are really falling through the cracks. And depending on, if they were hitting the EC, then yes, we would be reaching out. But if they could be silently struggling with diabetes, and we weren't doing enough to help them. And so that became obvious as we went through our journey mapping sessions and really did research and looked for solutions that folks that we were, in my opinion, dropping the ball on to get them engaged in some type of programming that could help them, be healthier. And so that was eye-opening. So as much as I agree we aren't focused as we should, and we send maybe too many communications, I think there's a bunch of examples of where we don't do enough. The IT resources, as I said, we did this inventory project last year, and looking at where our member communications are, a lot of them reside in our claims system, in our case management systems. They're not communication, they're not content management systems. And there's a huge IT lift to update those communications. And so to me, there's no value there, right? That's not a valuable time spent for our IT resources. We certainly have much, bigger and grander, innovative things that they could be working on, not changing somebody's name on a letter. And so we are, as part of 2020, actively researching how to pull those letters, those communications out and put them in a system that's flexible, allows us to do more personalization and to create business rules to help manage the number of touches to our consumers. So that's exciting, and we're really looking forward to that this year.
That's terrific. And then going back to what you said about the journey and really finding out kind of the white space of who you're not talking to, that's awesome. I mean, when you think about just having a consumer feel the value of their plan too, before re-enrollment comes up and they have choices, is so important. And you're probably preventing, kind of a worsening of health by reaching out to these folks that, are kind of at the beginning of their journey. So that's great.
Yeah, it's been exciting. It's been eye-opening.
That's awesome. Talking about NPS and satisfaction, you guys have won awards for member satisfaction. Tell us about some of the work you're doing that drives that.
Well, we, as I said, we're implementing a lot of foundational things to make sure that we understand the consumer and their needs. We have won, J.D. Power 3 years in a row. We're nationally ranked in the top 5 nationally for customer service. So certainly, we've fine-tuned that from a service perspective, but, we can't stop there. For us, one of the things we're focusing on is how do we take that customer service call that's, reactive, somebody's calling in for a reason, and we do a great job on first call resolution. All of our numbers are high, but then how can we flip that to a proactive or a sales opportunity? So, for example, if somebody's calling in about a claim regarding an ER stay, how can we educate them differently or promote different tools that we have if they have a specific chronic condition? So we are really focusing on that in 2020 as well, to say we don't want to rest on our laurels. We do a great job, but how do we take it to the next level? And so there's a lot of those kind of conversations happening within the plan.
That's terrific. Do you guys find that you're kind of doing measurement differently than you did, a couple of years ago? Are there kind of different ways to do it, kind of, by transaction, in context, different things for different segments? Are there some innovations there that you're thinking of either doing or thinking about?
Sure. We, over the last 2 years, also implemented a whole new phone system that allows us more flexibility, more real-time surveying of folks to figure out where we knocked it out of the park or where we need to focus on. So I think having that technology to gain additional insights to better know our consumers has led to a lot of decision-making on changing processes and removing friction from the healthcare system overall. So taking all of the information that we have, really mining through that data and coming up with insights and then fixing them. Some of them are really easy things. They're not complicated. It's just we didn't know because we weren't looking.
Sure. It's just knowing about them, really. Yeah, no, that's great. Awesome. Well, second to last area of this engagement and experience is really this optimization idea of finding ways to optimize the communications, whether it be kind of in the message, what channel you're using, things like that. And I know that's been a big driver and a big initiative for you all. Do you want to tell us a little bit about that?
Sure, I can give an example of something small that is making a big difference because, not everything is going to be the example I gave with the flu shot letter and making that change and saving a whole bunch of money and increasing engagement. A lot of them are going to be smaller wins, but will add up to being meaningful. So one of the communications that we actually worked on with your folks is a measure for osteoporosis and getting screenings. So we would send a letter out to somebody saying, hey, we want to come in and do the screening to fill a gap in care. And obviously I'm paraphrasing, but we looked at the letter and it really wasn't friendly. It wasn't really underscoring the fact that this is convenient and why it's important for the member. And so looking through the materials that we did, we made some changes to make it more friendly, really explain the convenience of this and why they should want to do it and the importance to their health, et cetera. So just making it a lot more member friendly. And we used to leave a leave behind with an incentive that was a letter that wasn't pretty, wasn't really, I don't even think people realized what it was because it looked like a form letter. And so we created a flyer, a postcard that was colorful, that looked more like a leave behind, again, underscoring the importance of what the screening is all about and, thanking them for their time, et cetera. So in doing that, between June and December, we had a 35% increase in engagement rate for HEDIS 2020, which is huge. And it didn't cost us anything, right? There was no expense there. And we saw a huge uptick in people responding to the notification as well as getting, it was a checkbox to fill a gap. So it was great.
That's terrific. That's terrific. The next and last area of this kind of engagement experience is also a big focus for this year and hopefully for ongoing, is really around the social determinants of health. There's so many fantastic programs out there, programs that pair college kids with seniors to prevent loneliness, ride shares, housing, food scarcity, ways to overcome food scarcity. Tracy, I know you guys have been involved in that, probably early pioneers in it. Tell us about a couple of the programs that you're really wed to and how you think about it.
Yeah, so we've looked at all the ones on the slide, as I'm sure most have. One of the things that we're doing within our local community is partnering with some community-based organizations to help be the boots on the ground, to help assess folks, really ultimately to close gaps in care, to make sure they're getting the health care that they should be, but managing through some of the social determinants of health that are found through these organizations. They're sitting in small little cities and suburbs of the Capital District here in Albany, New York, where we are, and making a difference because they're already getting, they have relationships with folks in their local communities, and so they're a trusted resource that then can help represent CDPHP and talk to folks about how to remove barriers like transportation to get to a doctor's appointment. If they need food, how to find different resources. So we have contractual arrangements with these CBOs and have goals set on both sides to make sure that it's a true partnership, and that's been really successful for us.
That's great. I think your point about aligning goals is really probably the biggest takeaway from this to really make sure that it's successful. Next up, we'll talk about, thanks. Next up, we'll talk about behavioral sciences. This is one of my favorite topics. I actually had come from the consumer world prior to coming over to healthcare. And so these behavioral economics are the same things that, in my old life, I got you to eat when you weren't hungry and buy things you can't afford or don't need. So I love actually using them for good finally. And there are things like, you guys have heard them all before, fear of missing out. When we ask a consumer to do something, hey, do you want to get that, or do you plan to schedule that colonoscopy? If a consumer says no, and we ask a simple, are you sure, and give them a reason to rethink it, we consistently turn up to 30% of no's into yeses, whether it's med adherence, gaps in care, well visits, you name it. Things like scarcity work really well. If we ask a consumer, hey, again, do you want to go ahead and schedule that? You need that specialist or that MRI or whatever it is. And they say, let me check my calendar, I'll call you back. Well, let's face it, they never call back. I don't call back when I do that. But instead, if we say, oh, you know what, this specialist's available and he's only got one opening in the next month, can I put you in? That idea of scarcity changes everything, and consumers are much more likely to actually make the appointment you need them to make or do something that you need them to do. A couple other ones that I'll talk about are just framing, kind of how you say something in relation to that person's background can really be significant in getting them to take the action. In our old life, we worked on some colorectal screenings where we framed it in their ethnicity, and it was recognized by NCQA because it moved the dial on a measure that, as we all know, is super hard to move on. But the last one I'll mention on here, just because it's fun, is peer pressure. Peer pressure is the same thing as social proof, it's called a lot, where like the electric company will show you your neighbor's bills to try to get you to use less electricity. We use it here very successfully, I will say, in a commercial population. When we do things like that, we get people to take action. The good news for us as a race is that as we move into Medicare, it works less and less. And so what I'm hoping is that the peer pressure that I still feel from high school will finally abate when I get into seniorhood. Next up is transparency. What's that, Therese?
I said I'll check back with you on that.
Yeah, please do keep me posted, and everybody else out there, please do. Next up is transparency. Obviously, there's a ton of talk around transparency with all that's coming down the pike from Washington around, really creating transparency for the consumer. And again, harkening back to my old life, I can remember when we had to put the fat content on the side of the Betty Crocker desserts and how just mind-blowing it was that we now had to answer to the consumers of what we could put out there. At one point, I had something that we were creating that was like 18 grams of fat per serving. And so we had to go back to the drawing board. But really, it lifts all tides. It's great for all because now we're adding one more step to empower consumers. But with it comes a huge burden to the existing stakeholders of creating transparency through all points of contact. So, Teresa, I know you're doing some cool work on it. Maybe tell us a little bit about some of the work you're doing around that.
Sure, we certainly recognize with the rest of our industry that this is really important and that we need to be able to drive transparency. So consumers, we're asking them to be more involved in their healthcare, but we're not giving them the tools to do it in this space in particular. So we have a solution today that is homegrown. We call it Price Check. It's only telephonic, so that's not overly convenient, but it's worked for us to date. In 2020, by the fall, we'll be rolling out a web-based solution for transparency that will include product design. So as you're looking up some kind of a service, you know where you are in your deductible, and you know ultimately what your member cost share will be. So that that's a heavy lift, and it's really table stakes. I don't know that it's innovative. We need to do it, but we're excited about rolling it out to the consumers this year.
No, that's terrific, right? And the more they can control what they know about, it's better for everything. You'll have more self-serve, you'll have less surprise billing, which we know is a trigger for lower NPS. So that's great all around. The next area, and really kind of there's a lot to talk about here, is really data. We have so much data in healthcare. I used to say that when I was at Betty Crocker, I would have killed for this much data on the consumers, just because not for a big brother's sake, but really to drive personalized, again, relevant communications for folks and interactions. And so key themes this year are really going to be around this extreme personalization. No more of just, knowing your name, address, and if you're male or female. We're now really needing to drive what that specific consumer needs to do in their health. Just what you talked about, Teresa, meeting them where they are in their journey and figuring out what that next best action is. To give you an example, we did a lot of work around various gaps in care segmentations. And we found that, with folks needing colorectal screening, we would segment them. And if they hadn't even picked their primary or got their well visit, you couldn't then go and ask them to get a colorectal screening, right? It fell on deaf ears. Instead, for those that hadn't picked the primary, we'd say, go pick your primary. For those that had, but hadn't had the well visit, that was the next step. And for those that had done both, we could ask them to get the colorectal. And so it became really kind of, again, meeting them in their journey and taking them to that next place. Another area that, is being talked about a lot today is interoperability. And that's an area, Teresa, that you've already kind of talked about, that you're doing some cool stuff with. Anything else you want to add there?
Yeah, I just think it's really important for us to make sure our systems are talking to one another, because it's so easy to get siloed and miss and really disappoint, right? If our goal is to delight the consumer, and we talk about things like gaps in care, and it's important to us as a health plan, but really taking a step back and saying, it's important for us to fill your gap in care as a health plan, but ultimately it's important for you as a person. So get your preventive screenings, make sure you stay healthy, because everybody wants that, right? Everyone wants to feel good. And I think that's really, we have to keep that focus to say, yeah, it's important to us, but it's also really important to the consumer. So your point about having access to all of this data, really we want to use it to make sure we are creating a message that resonates with somebody, that is meaningful to them, so they understand why it's important, not because we want them to close a gap in care. So I would just say having your systems all talking to one another so you have that total view is critical.
That's fantastic. And it even becomes more critical as we add in things like all the digital apps out there, even Fitbit input and things like that. It's only going to get exponentially harder. So at least getting what's in your four walls talking to each other is a big win for sure.
Sure, and that's something. So that's something we require from all of our partners, is to make sure we get member level data, because otherwise that's a deal breaker for us from a partnership standpoint, because we need that information from our whole ecosystem in order to be able to make that 360 view happen.
That's fantastic, Teresa. The last piece of the data I'll talk about, and it's one of my favorite topics, is A/B testing. A/B testing, I always say, is one of those things that it should be table stakes in healthcare. When I was at Cheerios, I had, one goal I needed someone to do in a very narrowly defined market. I had affluent moms, and I needed them to buy Cheerios. I didn't even really, frankly, need them to eat Cheerios, as long as they kept buying them. Here in healthcare, we have every walk of life, and yet we need them to do so many different things. And you might be great at taking your meds, but terrible at getting screenings. You might be wonderful at getting a well visit, but you're not great at paying your bills. And so thinking about unlocking all the different secrets to driving consumer behavior is really, it's a science. And so any time that you can do A/B testing and figure out kind of what is happening with individual consumers around, or individual cohorts around specific actions, you're just going to get better and better. And happily, this is another slide from our State of Engagement survey across the U.S., is we've seen just a growth in A/B testing from 2016 to last year that we're so excited about. It really is becoming adopted, more broadly across the industry. And so I think that means great things for all of us to really understand how to drive consumer behavior. The value, everyone always says, gosh, what do you test? I say the sky's the limit. There are things that make more sense than others. But really, no matter what we test, we find we can lift results across a variety of levers. Teresa, what advice do you have for folks that are trying to figure out their testing strategy?
I totally agree with you. I think it's super important, and we found a ton of value and insight in it. One thing that I would say is don't sacrifice this level of understanding and testing because you're in a hurry. And we've done that. So we fire up a new partnership, we want enrollment in that new program or new app or whatever the case may be, and we just push messaging out to everyone that's eligible for it because we want a quick enrollment cycle. And we have no learning, and so that's great if you get a whole bunch of enrollment, but we don't know who those people are and why they're doing it, right? So I would just say that take the time to set up the A/B testing and not just hurry to the finish line because it's worth the trip.
Great advice. So, Teresa, before I move into the Q&A phase, I just want to say a huge thank you. It's been a great pleasure, and I think everybody's gotten terrific wisdom from all of the things that you talked about. I'm now going to move into the question phase, and so we've got some great questions from folks in the audience. Thank you so much. The first one is for you, Teresa, and it's, where do you start? Right? You've talked about a lot of amazing things. There's a lot to do and probably only so much budget. How would you prioritize a couple of these things that you talked about today?
Well, I would say you don't have to tackle everything at once, right? You kind of have to start small and show value and create wins. And a lot of times you can find funding in that way to continue down the path. So there's a lot of stuff that you can do that we've done that doesn't really cost any money, which is trying to create a central point to organize member communications as an example. It's an investment of time, sure, but you don't have to have a big budget in order to do that. So some of it's basic blocking and tackling, and they don't have to have fancy tools to do it. So we've done that and have started to build that foundation. We have a long way to go, but you can't do everything at once. You kind of have to chip away at it, and that's what we've done, and that's how we're seeing successes.
That's terrific. The next question, and I'll kick it off, but would love you to also weigh in, Teresa, is what are the most effective ways you use marketing attribution techniques and processes to ID what is driving best engagement? And so we do work around really identifying all of the attributes of communications and interactions. For some clients, we have 5,000 row spreadsheets around everything from timing and channel and things like that, to really, rather than go in with a lot of hypotheses, to really let the data tell us what are those best attributes that are really going to drive engagement for us. Teresa, do you want to weigh in a little bit?
Sure. This is where as we've rolled out tools like Marketing Cloud and integration with Health Cloud, we've been able to gain a lot more insight on that type of thing. So prior to that, we weren't able really to do anything but send letters, and it's hard to measure that success. And so it's a lot more real time, and we can make changes on the fly in order to increase click rates or engagement rates. So that's been really helpful.
That's terrific. A question just came in. Teresa, how do you use your physicians to help drive engagement?
Well, we as CDPHP are physician founded and physician governed. Our president and CEO is a physician, so we have very close relationships with our physician community, which is great. We have a physician engagement team who really partner with us on a ton of initiatives. And so, for example, if we have a new partner that we're using to support a chronic condition, we create digital, awareness through the digital channels and target people in that way. But we also give that information in that cohort to our physician engagement teams, who sort of by practice go to the practices, educate the practice on a new tool or service that may help keep their patients healthy in between visits, for example. So we partner with physician engagement regularly on almost all the efforts that we do. I would say about 2 years ago, we realigned some of our resources and broke down a bunch of silos that were, between sales and marketing and the medical management team. And it's been really successful for us, and it's really worked.
That's terrific. Another one came in of how to use SMS, and I'll jump in first. But I definitely want to hear what you guys are doing. We're helping a variety of clients with SMS programs, everything from kind of setting up the strategy of how to use SMS, right? Because it's a different channel and it should be used in a different way than a lot of the other channels out there. But we've seen some terrific success with condition management, even getting Medicaid folks involved in their condition. We had over 80% of them stay involved for 52 weeks of messages, which I like to joke that even when I sign up for Nordstrom's 52 weeks of messages, by the third week, I've unsubscribed. So, finding the right channels with the right value for certain folks can really create a wonderful sticky program, because SMS is real time. And so it's a wonderful tool when used most effectively. Teresa?
So we are in the beginning stages of using SMS. We have done some pilots with about 5,000 people. We find it to work really well with our student plan market and on the Medicare side, but this is an area where we are definitely still learning and in development from a strategy standpoint.
Terrific. Do you see big differences across populations in their readiness for digital, especially folks struggling with social determinants?
We have had a lot more success in the commercial market, really because we've focused a lot more from a digital standpoint on them for longer. But we're seeing uptick now that we've engaged all population in this measure, and research that we've done, both locally and national research that we've compiled, shows that everybody, there's a huge population of people that want to be digital, and it's not based on age. So, there are certainly people who don't want to go digital, but it's not because they're in the Medicare population, for example. So across all line of businesses that we support here, we see a huge uptick, specifically in mobile.
That's great. We had a new question just come in. How does CDPHP gather social determinants of health data on your members today?
So we have third-party data that we can append to our membership, and that's fairly new for us. In the last year, we've been using that. We use our community-based organizations to help identify and solve for folks that have different types of social determinants. And then lastly, I'll say our care management team, always the first question for folks is to understand what their current situation is, because something that might be important for us, like a gap in care, isn't important to someone that doesn't have housing, for example. And so we have a lot of resources that our care management teams are trained in to help really member by member solve and work through some of their challenges in order to set them up to get the health care that they need.
That's great. That's really helpful. I'd like to give people 5 minutes back, so I'm going to end with a personal question, Teresa. Tell us about a personal experience outside of healthcare that you found positive that healthcare could learn from.
Oh, great question. A friend of mine recently got married, and she ordered her wedding shoes from Zappos. And she received a couple of days later her shoes, which was great. She also received a huge bouquet of flowers congratulating her on her wedding. So that was completely unexpected, and I bet she has told that story to every person that she has met, everyone that was at her wedding, every person that she has met since. So it was completely unexpected, and she was absolutely delighted. So I think we can do more of that and surprise people in our industry, as they meet milestones or what have you. So I think that was a great example, and it's one that, has resonated and been told over and over and over again.
That's a fantastic story. And you know what? I can relate. About 5 years ago, I had a daughter with a broken leg in February, and had, many communications with my health plan. And then in June, I actually called about a different daughter, and the customer service rep said, "Hey, how's that daughter with the broken leg? Did everything turn out okay?" And just like you said, I was absolutely delighted, because it said to me, you know me as a person. So I think you're spot on with that. Just want to say a giant thank you to Teresa. You were amazing, and I think everybody got a lot out of it by the excitement around the questions. I'd like to tell everyone here that we will send a link to this recording for all of you. And again, if there's any other questions you want to ask, feel free to reach out. And I still would love to hear from you, any burning questions you have that I could ask folks that are challenged with social determinants of health in March, and I will get right back to you with the answers. So thank you, Teresa, and thank you everyone for joining us today.
Great. Thanks, Kathleen. Thanks, everyone.